feel good. I knew that I wouldn't. I feel good.
Santa Clarita's hometown station, AM 1220 KHTS. Make sure you go to hometownstation.com for all the latest and greatest in the Santa Clarita Valley. Joining me in studio, this is the Prima Pediatrics Healthcare Hour. Is that what we're talking? Healthcare hour? Is that okay?
Yes, that's what we're calling it.
That's what we're calling it, the Prima Pediatrics Healthcare Hour. Of course, you can find more information at Prima Pediatrics. You can go to 424-9000 is the number there, 661-424-9000. Dr. Feldman is joining me in studio, and it is, it's September 13th, a couple weeks in now to school. And I want to talk a little bit about kids' health and stuff like that. And we were talking before the show, and you said that there is a flu epidemic right now.
Yes, surprisingly. In fact, I've been in practice for over 35 years, and this is the very first time ever that I have seen influenza this early.
Good
Never
grief.
seen this before.
Has it ever happened? Like, if you look in the books, has it ever happened this before?
It's an interesting question. I've kind of looked. I don't know if it was, well documented before this. It's hard to know. I do know that approximately, I guess it was about 8 or 9 years ago. Let's see, it was 2006. Well, a little earlier than that. It was about 7 or 8 years ago that my daughter started her internship. Actually, It was exactly 7.5 years ago. And within 3 weeks of starting her internship at Sunset Kaiser, she became sick enough that she had to actually stay home for 2 days, which for an intern is unheard of. And then within a week, I got it. She was kind of, she moldered with it for another week and a half, but then I got it. And I, for the first time in my memory, actually, the first time ever in my practice, actually couldn't work for about almost 3 weeks. And I was so bad, I couldn't breathe at all. I ended up skirting the hospital, so to speak, and found out that I had influenza and mycoplasma pneumonia. So, and that was in the end of July, beginning of August. So, does it occur at other times? Has it ever been documented to occur? Yeah, it does occur occasionally in the summer on a rare occasion. Clearly, I thought we were one of those. But has I ever seen it occurred in large numbers? Where there's more than just one rare case? Not to my knowledge.
So epidemic, what does that mean? Does that mean how many people classifies it as an epidemic?
Well, an epidemic has to be a percentage of population, and we haven't quite hit the epidemic yet, but we are now in flu season, and the reason that we know this is we got a flyer at the beginning of the week from the public health department, Dr. Fielding in LA County, saying that they had the first reported case of hospitalization for influenza pneumonia. That one was influenza A, H1N1. So that we were supposed to be on the lookout for it. No sooner did I get that, this was on Monday, then on Tuesday we had a child come into our clinic, a young lady in fact. She was a teenager who presented with classic influenza symptoms, as did her brother. So with the knowledge aforehand that I knew about everything else, I ran an influenza test, and they had influenza B.
Good grief.
Today, we got a notification from a parent, actually a father, calling us to see if he and his kids could come in and get their flu shots right now because his wife is currently hospitalized with influenza pneumonia. So it seems to me flu season is definitely here.
If you're getting phone calls like that, certainly.
Yeah, and I've never seen it this early, ever. I mean, it may have occurred, I suppose the epidemic of 1919, but I don't think we had the epidemiological tools at that time to know about it.
Yeah. And so let's get into maybe the symptoms. What are we looking for? Flu-like symptoms. Maybe, some people get fevers, but they're just like, that can't be the flu. So what are the flu symptoms? No, that's
not true. Actually, fever is a cardinal symptom of the flu.
Okay.
It's not a necessity. A lot of people say, I have the flu, and they mean stomach flu.
Okay.
And so they're getting, vomiting and nausea and diarrhea. That's not flu. Okay. Although it can be a symptom of the flu. But if that's all you got, that's a stomach virus.
Gotcha.
Which are also very common at this time of the year. They're the enteroviruses. But the classic thing with flu is not only usually it's like nausea and vomiting rather than the diarrhea, and respiratory symptoms. The respiratory symptoms are the clue. And you can have the respiratory symptoms without the stomach symptoms and still have influenza. But it's almost always involves cough, runny nose, which you're going to get with a cold virus, fever, stomach symptoms, and most importantly, aching. If you ache, then you better get in because you've got influenza. And the idea is that if you have influenza and you can't afford to be out of work or out of school for a week, get it in the first 72 hours of symptoms, preferably the first 48, because then we can give you Tamiflu and it will ablate it. And you'll be back to work or school in a day or two. But if you wait longer than that, it won't work.
Okay.
So that's the trick. And most importantly, as soon as everybody gets their flu shots in, come and get your flu shots early this year. Usually we kind of push it for October, November, because usually the earliest flu season starts is mid-November. But this year, come in as soon as you can. Our practice has currently got the flu shots for little kids, the ones from 6 to 35 months. And we've got the nasal flu vaccine, but we don't have the older kids' shots, even though they were supposed to arrive 2 days ago. But, what can I tell you? But we should have them hopefully by the end of the week next week.
Okay, so I want to talk about, we're going to go to break real quick, but I want to talk about preventative stuff. I know kids are going to school. What can parents tell their kids to help prevent flu stuff and
all the other good infections,
and all that other stuff, because school's starting? Okay, we're going to talk more. This is the Prima Pediatrics Healthcare Hour on your hometown station, AM 1220 KHTS.